I would like to welcome all of you to this very important panel. We are really happy and glad that we have such an important subject as actually first panel today. I would also like to welcome our audience online. And unfortunately, Johannes Rauch, the Austrian Minister of Social Affairs, Health, Care and Consumer Protection, cannot attend today due to illness. This session is co-organized by Women in Global Health Austria and the European Institute of Women's Health. I would like to wish all members of Women in Global Health Austria happy birthday, because it's 1 year that it was founded in this room. And I would like to congratulate all the members and the core group for really great events that happened during this first year. It is an honor for me to moderate. It is an honor for me to moderate this session. I would like to introduce you our renowned panelists. So I would like to start with Peggy McGuire. She is the Director General of the European Institute of Women's Health. Peggy is already involved in advocacy for women's health for already a very long time on the European level especially. Then we have Pei-Ling Yap. She is Chief Scientist, Health AI. And we have also Tatiana Klimanova. She will join online. She is Accelerator Director at FemTech Lab. And I myself, I'm Sabine Ludwig. I'm a professor for diversity in medicine at the Medical University Innsbruck. Now I would like to first start on our gender health gap. That is still persisting, and I would like to start with looking at life expectancy. We know and we see that women live still longer than men, but 9 years in bad health. And men live 6 years, 9 months in bad health. So what's wrong? Yeah, there must be something that is not as it should be concerning healthcare for women. If we look at chronic diseases, for example, depression, the prevalence of depression is higher in women than in men. We have cardiovascular diseases is the main cause of death globally for women and men. The prevalence is still higher in men, but women underestimate their risk. So very importantly, all women, especially around menopause, as soon as the female sexual hormones are decreasing, we see an increase of risk of cardiovascular diseases. Please be aware of that, as well as different symptoms in heart attack that should be known to all health professionals and also to the whole population. Autoimmune diseases are more common in women, and we also see that neurological diseases, especially dementia is increasing, and the prevalence is higher in women, because one reason is because they are older. We also, I would like to quote and to open the perspective a bit globally, and would like to quote Pascale Allotey, the director WHO for Sexual and Reproductive Health and Research. She said, "Every day we have 800 pregnancy-related deaths. That means every 2 minutes, 1 woman dies because of a pregnancy-related issue that could be prevented. We have 270 million women who have an unmet need for contraception, and 73 million abortions every year. 50% of them are unsafe. And 1 in 6 people experience infertility in their lifetime." So we definitely have, as far as the global women's health agenda and strategy is concerned, important issues that we have to kind of tackle together. I would also like to point out some economic issues. There's an important gender pay gap still in, I have the European data now, European Statistical Office from 2022. So the German-speaking countries, including Austria and Germany. So in Austria, it's 18.4% gender pay gap. Compared to Italy, they are only at 4.3%. So, and we know that having little income and is related to health and health status and disease. So we also have to tackle this issue. So now, can we use digitalization and digital tools, and how could they be developed, and what the concept should be in order to tackle those gender health gap issues that I have just mentioned. And in order to find some answers to these very important questions, I would like to go now to the panelists, and we will start our panel discussion. And before I'm going to ask the first question, I also would like to address you as the audience, and I would like to ask you, who in this session uses an app or digital tool to track an aspect of your health? Please raise your hand. Yeah, okay. The second question would be, who in the room has heard of FemTech? Okay. And who in the room is using a FemTech app? Okay, the numbers are getting smaller and smaller. Thank you. Now I would like to start with the first question. I would like to address this question to Peggy. So what do we need to consider when designing and innovating in the digital health tools and applications generally, and also in regards to gender? I will have both of you answering this question. We would start with Peggy and then Pei-Ling Yap.
Well, I think considering when we're considering the development of technical AI for women, particularly FemTech, I think first of all we need to consider what are the health needs of women and what are they need in relation to AI. I think this is one of the issues that isn't considered in the first instance. And secondly, I think we need to have inclusiveness and data that is disaggregated by sex, because this is the way we can prevent disadvantage, one sex over another, and also to make sure that any health policies or AI policies that are developed, digitalisation policies that are developed, are targeted specifically at women. So those are the main points that I'd like to make initially. And also to remember as well that not all women have access to digital health because of who they are, where they live, socioeconomic and geographic location, etc. Or they may be part of a marginalised or vulnerable grouping. So I think this is a huge issue that needs to be considered also, so that no women are left behind in the development of FemTech and digitalisation.
Thank you very much. Very important points, but I would like to give the word right away to you, Pei-Ling.
Thanks a lot, Sabine. So I think for me, it is critical to have the woman's voice incorporated in the full design, development, and deployment lifecycle of these AI applications. So actually, a few years ago, we actually did a little project looking at how to develop citizen science participatory research approaches for pandemic preparedness and response. And during this project, what we did was to approach citizens not just as mere data providers, but also letting them play critical roles in terms of problem definition, in terms of even participatory in the development of models, right? The development of predictive models, the interpretation of these model outcomes, as well as the communication of some of these key health messages. So I think this citizen science approach that I just described could make a lot of sense for the development of AI and FemTech. I think we really need a lot more participation from women in understanding, like what Peggy said, really the specific health needs and requirements that they have. Having them, I think, involved using participatory modeling approaches in understanding their perspectives and understanding their interactions with the various stakeholders in this landscape, to develop predictive models that would predict outcomes of their health would be key, as well as to bring them in crafting key health messages, disseminating health information to their peers. I think there's a lot of potential for these participatory research methods to be explored. But on the other side, I also want to point out that it's not just the researchers and developers that has homework to do, right? I think the funders actually funding the research got to create more specific funds to advance or to target women's health. So for example, I know that IDRC Canada, they have a program that looks at advancing, I think it's advancing research on feminist AI to advance gender equality and inclusion. And I think more of such similar funds would be helpful to drive this R&D field, to drive the industry forward. Yeah.
Thank you very much. And now I would like to turn to our online panelist, Tatjana. Would you like to add something to this question as well, please?
Sabine, thank you so much, and I apologize for not being able to join you over there in the room. It makes such a massive difference, but I guess we are embracing the tech, and I'm able and I'm grateful to join you from London. AI, it's such a hype right now, right? I'm hearing AI here and there, but I think I couldn't agree more with Peggy and Pei-Ling. It's you train AI on data, right? Considering the lack of data and research in women's health, we need to be super careful what kind of data we train an AI on. And also, I guess I'm representing as a part of the FemTech Lab team. I'm helping founders in women's health go to market, connect them to investors, connect them to corporate partners. So I'm seeing both sides, investment side and founder side and innovator side. And it can be, investors love AI, and we need to make sure that innovators focus on the solution first, rather than trying to build something with AI just for the sake of AI, because investors love it and they are more likely to give you the funding, unfortunately, if they hear AI. But just focusing on the right data and the right solution first would be kind of my first thoughts.
Thank you very much. Then I would like to continue and ask you, okay, where can digital health tools play the most important role in the care pathway, in your opinion? I would like to maybe Pei-Ling. And then
yes,
Peggy and Tatjana.
I think given the sort of pervasiveness of digital tools in our life, they can really collect a lot of signals from us in a very ambient manner. So I really see, or I'm especially excited about them playing a very strong role in promoting healthy behaviors, right? For specific for our age, for our gender, and also preventing us from taking actions that might have undesirable health consequences in the future, and perhaps also detecting early signs and symptoms of disease conditions. So I think really in the sort of early stages of the care pathway would be something that I think would be especially relevant.
Thank you very much. Peggy, you have something to add?
There's huge opportunities there, I think, in using AI, particularly, as you say, in health promotion and disease prevention areas. And I think information to women on, say, for example, vaccination. I think this is crucial, I think, for women. But I don't think we should forget there are challenges here that not all women have access to technology and to AI. So we need to be very, very careful when, again, it goes back to the whole development area and having women involved from day one. So we must be considerate of that. But I think there are opportunities there, and I think it would just need to be cautious, particularly from, I know we had a project on digital health literacy, and we had focus groups on young women and also on midlife and older women as well, just to ask them what they felt was the priorities from a care perspective. And the young women said that they wanted access to contraception information and etc., sexual and reproductive health, and the midlife and older women wanted information on menopause and how to keep healthy, and it was all health and well-being issues. And what they did identify was that there wasn't any one platform where they could go and get this trusted information that they needed across the life course. And this comes up again and again in all the focus groups that we held over a 2-year period, that the governments, the ministries of health, there's no trusted platform, digital platform, where they can access information to make informed choices.
That's a very important point. And I would like also to come back, actually, the digital gap in general, also between Global South and Global North. Yeah, it's very important. Actually, I have looked it up, and if we look at Africa, compared also to Europe, there are 32% of women who actually use the internet, and men it's 42% compared to Europe, where it's 90% of the women and 92% of the men. So definitely, if we talk about female technology and those solutions, we have to take this into account. And also low income, as if we look at low income countries in general, it's 20% of women who have actually access to the internet, and in high income countries it's 93, so it's even lower.
Yeah.
It's a very important point, please.
Just another thought came to mind as well. We're talking about women who are pregnant, and one of the issues that came up in one of our focus groups was the lack of information on the safety of medicines in pregnancy, which is a huge issue for women who are pregnant. And because women aren't included in clinical trials, obviously pregnant women aren't. So therefore, sick women get pregnant and pregnant women get sick. So there's a use of data again. There's no research. There's no pharmacovigilance system that can actually gather the information on adverse reactions during pregnancy. So we have 5 million women getting pregnant every year, and 98% of these women take a drug during their pregnancy. And what you often happen is that women with chronic diseases actually stop their medication because they don't have information. So I think this is an opportunity again for big data, AI, but again, you're talking about data and you're talking about disaggregated data and putting women at the centre of research and collection of data again.
Actually, I have one point sort of as a response to what Peggy just said, and I think in addition to this kind of, a trusted platform, sort of a one-stop shop, right? I think the idea is also to look at how we can bring data with us as we, go across border, as we go visit different institutions, and also data that we feed into these FemTech applications, right? How do that get transmitted and sort of analyzed and sort of get sent to our doctor when we next visit her, sent to our gynecologist when we next visit her, right? So I think that as well, I think that kind of infrastructure should be, something that we aim for in addition to that one-stop platform.
Great, thank you. Tatjana, before I come to you, I would like to refer to one point what you said also with the clinical trials. I didn't mention it in my introductory speech. Of course, we still have the issue that in trials we still have women underrepresented, and especially pregnant women because of the reasons. But I know that now the European Medicine Agency, there are incentives for all European pharmaceutical companies if they prepare trials and conduct trials that you have actually to include the equal number of women and men, and also include pregnant women. And what we do in Innsbruck, and that's also what the professor who was there before me has started, that all PhD students, before they start actually really with their work, they have to kind of discuss with us their study design of their project to make sure that really enough women and men, that there's a diversity in the study cohorts that they are going to look at. I think it's a very important point to get data that we can then get into AI and to develop the tools.
Yeah, and I think that the issue as well is that, older people need to be included in clinical trials as well.
Absolutely.
Because they're multi-pharmacy, we're living longer. So therefore, with the clinical trials revision in 2014, gender and age were included. So therefore, if you're not including these people, you should be. But I think the other issue about the European Medicines Agency is there should be guidelines on how to disaggregate data in clinical trials, because that they don't exist at the moment. So that's one issue that we're looking at from a European perspective, that there needs to be, the EMA should develop guidelines in conjunction with scientists and also women's organisations on how to collect data and how to collect disaggregated data in clinical trials. And this is so important. Just one last thing, that we have a project called Conception, which the EMA is involved with, and we brought to their attention the fact that the safety of medicines in pregnancy was a huge issue and needed to be addressed at the European Medicines Agency. So I just want to say that if anybody wants to look at that, it's conception.eu, and they're looking at safety of medicines and big data in pregnancy.
Great, but maybe I would like to take now this opportunity. Is there someone maybe from the European Medicines Agency in the room that would like to comment on that? Okay. But then I would like to go to Tatjana. And do you have any comments to what we have just discussed that you would like to add?
It's just absolutely mind-boggling that in this day and age, we're still seeing women die from pregnancy-related issues. We're still seeing only 4% of biopharma research and development funding go to women-specific research. But just wanted to say a massive thank you to Sabine, you and the European Forum for Health for having this conference. And I think the initiatives like this really help push forward the industry.
Thank you. I would like to ask you now the next question, and then we would also like to ask the online audience if there are any comments or questions to us at this point. To Peggy now, can digital health tools help improve inequalities in women's health? I mean, we already kind of started to discuss this, but if you would like to elaborate on this.
Yeah, again, I think, there are opportunities there for AI to contribute to the reduction of disparities and inequalities in women's health, in making information available, particularly in the prevention and health promotion space. I think that's important, that we have trusted information, trusted platforms that women can access. I think that's the first issue. Also, I think one issue I think that's important, particularly, again, that women have mentioned, is the whole privacy issue, that they want to know that their information in data has been secure and will be resourced properly, and particularly secondary data. So they're very interested and very worried about the privacy issue and the security of that data. So that was secondly. I just want to mention these are women's voices, so it's important to hear women's voices. Again, I would be cautious. I know it does help women in accessing telemedicine, for example, if they're in remote locations and they can access treatment and consultations with online medicine, but it cannot replace face-to-face consultations either, but it can help. And it also looks at a cost situation as well, that actually producing and delivering care in that way can reduce costs, I suppose, to health systems as well. But a cautionary tale, we have to look at the digital divide. Not all women have access, and also to be culturally sensitive as well, and particularly with Europe's situation at the moment and marginalised groups and the amount of migrants that we have now moving, so to make sure that nobody's left behind.
Thank you. And actually, I would like to pass to you, especially concerning the AI Act. Do you think that those issues, especially like gender aspects or like the fears of women, are adequately represented or discussed, also concerning the privacy?
Yeah, I'm glad because I think that's one point that I would want to follow up on what Peggy said, right? I think the potential to address inequality is there, but I think the right governance and the right regulatory framework has to be in place in order for this potential to be fully harnessed. And just before we go into the EU AI Act, I just want to say I'm not a lawyer, so I'm a pharmacist and epidemiologist by training. But if you take time to read through the articles of the Act, you will realize that they do mention gender equality, so there is a flavor there. And also it is acknowledged that AI development teams should be gender balanced. So we are on to a good start. The other thing is also within the AI Act, there's a lot of obligations for AI systems that are of high risk. And a lot of the AI systems that we're using in healthcare are actually high risk. So they do have certain obligations to fulfill. And I think there are tools there that will help them to fulfill these obligations when it comes to, let's say, preventing harm to fundamental rights, detecting biases, mitigating negative impacts. All of this have their relevance to gender equality, right? So for example, in terms of the tools, within the AI Act, they promote the use of these fundamental rights impact assessments that providers have to do such an analysis before they deploy their tool. The Act also requires appropriate measures to detect, to prevent, to mitigate biases. So you need to have, risk management systems in place, the right data governance structures to be in place to ensure data quality and equity. You need to have proper documentation of the AI processes and decision-making process. So again, complying to sort of transparency requirements. and more importantly, to provide the human oversight. So yeah, so I think the EU AI Act does give that sense of, does give room for gender equality, but I think Peggy and I also said that there is no specific tool really addressing gender equality. But for now, I think we are onto a good start and on the right track. Yeah.
Thank you. And Tatjana, I would give you again the word from your perspective. You would like to add something?
Yeah, absolutely. I think Pei-Ling, as a great expert in the area, and Peggy, I just could only agree.
Great, thank you. Now I would like to turn to the online audience, and we have actually Mrs. Metzger from Women in Global Health Austria who assists us with the online audience. Please, are there comments, questions from the audience?
Yes, hello. We have actually some questions regarding the privacy and as we have heard now that this is an important topic, something that women are concerned about. And there have been some questions. One was about if there are any controls to ensure credible apps and digital tools, and how to address these concerns specifically, not only talking about the problem, but how to really address this challenge. And there was also the question to how to include or incorporate these tools into the health system. But maybe we'll come to that later on exactly. So the question is how to ensure credible apps and privacy.
So I think when it comes to regulation of AI, I think oftentimes now a lot of it is on medical devices, AI-assisted medical devices. I think mobile health applications often fall through the crack in a way. A lot of these FemTech applications might not sort of suit the criteria to be sort of regulated under the medical devices regulations. But what we at Health AI are doing with IEEE, a standard setting organization, is to really try and see how we can put together a registry for mobile health applications. For now, we're starting with mental health, really looking at mental health mobile apps. But I suspect that FemTech could be a next relevant topic coming up. But I think registry like this will provide that sort of trustworthy source for just consumers to say, okay, if it's not prescribed by my doctor, but I have this registry to say, okay, I can choose this app. It has gone through some form of selection criteria that would ensure its safety and effectiveness. Yeah, so there is kind of work being done on that end.
Great. Thank you. Does any one of you want to add something?
I think, well, Pei-Ling, I think, is the expert in this area. I just want to say that the European Commission, we do have GDPR, so therefore we have to comply with those regulations. But I think it needs to go further in relation to FemTech, and I know that has already stopped people in their tracks from, I suppose, overriding any kind of privacy laws. But I think Pei-Ling is the expert in this area.
I would like to turn back to you. So the other question on the health system?
There was one very important comment from some viewer, and that was that aggregating data by gender is important, but since that there are people that don't have access to AI or to the digital world in general, it is important that we kind of see and reflect upon that it's not within this data that we collect if we think about people that are not able to use digital devices, for example. So that was a comment. And yes, there was also another question about the challenges for FemTech funds, how FemTech devices, apps, companies could get the funds, or if there are any funds available. So maybe a question for Tatjana.
Yes. Tatjana, please, for you.
Such a good question. Unfortunately, as we know, female founders, there are 70% of female founders in women's health, and I think it was only 2% of women, of all the funding in 2023 that went to women's health, of the overall health tech funding. It was about 42 billion invested into health tech in 2023, and only 2% of that went to women's health. So female founders facing double challenge, being a female founder and building the women's health application. I mean, in terms of funding, there's it doesn't matter how you think impactful your solution is, how big a challenge it solves. For VC, for venture capital investors, the bottom line is the ultimate question. So it needs to be, there needs to be a business case, it needs to make revenue. So, and we're also seeing more VC funding, especially now in recent times, go to later stage women's health companies. So we usually, at FemTech Lab, we usually, venture funding is not always, it's a good option, but it's not always the only solution for entrepreneurs. You can go, there are fortunately grants becoming available, there are government funding available, so there are a lot more alternative funding available now for, especially for women's health and female founders available.
Thank you, but I would like to actually add one question on this. As you just outlined, yes, we see there, 70% of FemTech companies are founded by women, but only few funds go to them. You just explained that it's improving, but where do you see the reason for this?
The reason is, well, I guess it's a combination of systematic bias, historical patterns. So, for example, we're seeing a lack of representation in venture capitalists of female decision makers or specific funds focused on women's health. Although in the last kind of year or two, we see a lot more specific women's health funds appearing on the market, but still it's incomparably low. So, for example, 90% of all funding that went into women's health last year, 90% was made by male investors. And that's just because there are more male investors, and it's a perception bias. So investors are more likely to invest in founders that resemble themselves. Unfortunately, it's a bias for all of us. And of course, if it's a male investor, they would likely to invest in male founders. But there is also and this is like research has shown, but at FemTech Lab, we have accelerated over 70 startups in the last 4 years. And I have seen it firsthand that female founders somehow are being asked more preventative questions focused on risk mitigation and the downside, whereas the male founders are being asked promotional questions focused on growth and opportunities. For example, this market has a great potential. How are you going to build your product to grow fast enough to capture the market growth? Whereas a female founder can be asked questions like, it's a very saturated market. How are you going to protect your market share? And we focus a lot on making sure that the founders are ready for those questions and they can tweak them. There's a whole art and science on how you can approach investors and kind of tweak that. And also a lot of investors are looking at previous successes. They more likely to invest in founders who have built companies before, who have been funded before, and unfortunately, it's just a bias that continues to kind of reinforce itself because women had lack of access to funding previously, historically. But also, what's more frustrating is that women's health companies have been consistently valued at a lower valuation than other companies. And I guess this is going back to what Peggy was saying. It's due to the lack of data available, it's very difficult to show investors the potential of the problem, how big it is, the size of the market, how great the size of the market. It's harder to get FDA approval with the lack of data and research. So again, going back to data, it's so important that women are being now included in clinical trials, that a little more funding is going into research and R&D, but still nowhere enough.
Thank you very much. And any more questions that we should answer now?
Well, there's one more question that came in that maybe is a grounding question that should have been answered first. But the question was how we really define FemTech. If it's largely apps or wearables, or what the definition is. So maybe we can go back to that and to understand it better.
Maybe I give it to Tatjana.
We define, again, at FemTech Lab, we define FemTech as female technology, but we define FemTech as any technology that can address women's health solutions, any conditions that affect women disproportionately or solely affect women. I guess Peggy and Palin can add to that definition.
Yeah, I'm fascinated with what Tatjana's saying. I mean, I think I agree with your definition, Tatjana. It's any innovation that supports women's health across the life course. But I'm fascinated with Tatjana as well, if you don't mind me saying so, that that the lack of investment in women. And I mean, Tatjana, I mean, I know, sorry, just do you think that funding should be ring-fenced? For example, the European Commission, should it be ring-fenced to accelerate women and women to be invested in, and also to maybe to innovative health initiative? Is there room for some development there to support women like you? And also there's the accelerator program in DG Research as well. Should we be approaching them as well?
Very important.
Yeah, 100%. And if you don't mind jumping in, as a startup ourselves, as an accelerator, we're not government funded. We're not a VC fund. We scrapple around for some cash to give to startups to pay ourselves. So it's a really tough industry. So I think in terms of ring fencing the funding, I think we need to really look at the government funding. So I think Innovate UK is a great way to get funding for startups, but we haven't been seeing a lot of transparency in terms of where this funding is going. I know there's been allocated about 25 or 50 million this year, and only less than half of that has been awarded to female women's health companies. So I think government and grants is what we need to kind of look at.
But Peggy, this would really be something that you could, bring forward on the EU level, definitely, because I think it's still something that is deeply rooted in gender identity roles that, also if we look at ministers who are actually responsible for finance and budget, it's a very low number of women. But if we look at health ministers, this is one of the resources that is more likely also to be given to women. So I think this is really, deep rooted in our societies, our socio-cultural dimension of gender. So I think it really needs legislation on the EU level that makes funding going to the women. And I just actually also listened to Chloe, who also founded a very important app, and she said that, first of all, if they see it's a women and that it's actually on women's health, so it's actually double. So that kind of doubles the barrier to give money to this, even if it's a very interesting and innovative field. Yeah. So unfortunately we see this, but may I still stay with you and then we go on. But so if you assess founders and if you talk to them and advise them, is there now any product, you already mentioned a couple of products, that you would now suggest, especially that, would have big potential. I mean, we have talked about menopause, we know a lot of the reproductive apps, but is there anything that you would advise them?
Oh, sorry, Sabine, is it a question for me?
Yes, you know, because, yeah, please.
Yeah, absolutely. We have so many startups at the accelerator, and before selecting startups onto the program, we try to be very vigilant in terms of making sure that the solution is backed by data and evidence, and that startups have medical advisors and doctors on their board, or as part of the founding team, or at least their chief scientific officers. So this would be something I would urge all users of those kind of solutions to check. One of the solutions that I love is Utility Health. It's based in the UK and founded by amazing Helen O'Neill, who is a reproductive doctor. Let me think, just off the top of my head. There are so many, I can't, but plenty. I'll come back to you with a few more.
Thank you. Now I would like to ask the audience, do you have anything maybe to add, a comment on what we just discussed? Please. If you would introduce yourself maybe with one sentence.
Yeah, hello. My name is Birgit Bauer. I'm the project coordinator and founder of Data Saves Lives Germany, and I'm a digital health and social media expert. And I'm one of those patient experts here across Europe, and I have some points for you. But thank you at first for the great discussion, because for me it was really interesting to hear that I'm not alone with the problems I see every day from the Data Saves Lives Germany community, and also from my community as a person living with multiple sclerosis. I have a worldwide community, and the ladies are suffering, I can say that. Regarding access and also how to use the World Wide Web, I would say let's do it in health literacy. We have a very, very low, unfortunately also in Germany, I can see the literacy regarding using digital tools and also doing a good research, not Dr. Google, using other tools, because we don't like Dr. Google, we all know that, is one of the points. And we have to grow that. We have to do education. And what I'm doing is to build a platform at the moment for people living with chronic diseases, also for ladies, to let them know, hey, here you have the trustworthy source to find some more information about health tech, also digitalisation and digital tools. And I think we have to grow that. We have to work together on this, because we need to support them to learn more. And then we can see also older people coming into the internet, coming to do research, but they want to have more. They need the knowledge to come up and say, okay, let's do it, I try it. So we have to motivate them differences. And there are a small number of patient organizations doing something for this, but it's too small. And we are too less. We are a small group we're going to be louder, but we need more support also from the health community, I would say. Regarding safety, yes, safety is important. We have the GDPR, we have all those new laws, also the European Health Data Space with that laws. I was working in the German group also with the typical German name, Gesundheitsdatennutzungsgesetz. So it's the new law came up last year to protect health data. And with Data Saves Lives, we can see people using these little buddies here. You can see this is my iWatch. I'm sharing my data all the time. They are using Facebook. They are using WhatsApp. They agree on sharing their data, and they don't ask what's with their privacy. So we have also to give education in data protection and data privacy, because this is the other side. We also see that importance. But on the other hand, those ladies and also those men share their data already without having any, I would say, They don't ask, they just use it because it feels like home. Need of data, data saves lives. It says it. I'm one of those guys saying we need more health data, and I want to say we need more women's health data. I'm coming from the ACTRIMS Congress last week in Copenhagen. It's the world's largest MS meeting, and to see that huge, massive number of such a great scientific data transfer we had there. Lots and lots of sessions. But the number of sessions for ladies in the menopause, for women going to plan a family or something, and also digital solutions, tech solutions for ladies. I'm sorry, I was out. It was too less for me. It was so lousy. And I said to the guys also there, please bring up more solutions and also data of women for women. Share your knowledge outside, because those ladies suffering, they don't know what we are here talking about. We are in a bubble. But we need to transfer that knowledge outside. And last but not least, we are living in a challenging time. And I couldn't agree more that you say, Peggy, don't leave anyone behind. This is most important. We have to create an environment where people can inform themselves, they can learn, also women, and also let's collaborate. Let's found those big ladies networks and come together and do something, because this is important, and also the patients, the ladies living with diseases, because they are so important. Thank you very much. I'm sorry, this was long.
Thank you very much for those really important intervention and points. Does Peggy, I think you want to? No, please. No, for these very important points, of course, you're right. And if you just, pointed out you were at this big conference on MS, and there were nearly no sex and gender aspects being discussed. Like in the field of gender medicine, we have now some professorships all over Europe, and in the different conference, different fields, we try to integrate it. But still, you cannot kind of convince all of the colleagues, and that's why it's so important to start with the students and to really get them know the importance, and because it really has an impact on the outcome finally of the patient and healthcare. So thank you for this intervention, and I would like. Oh, please, sorry, please.
That was fascinating. I'm Martin McKee, London School of Hygiene and Tropical Medicine. And I'm just trying to sort of break the problem down in my mind to see where it lay, because it seems to me, and you're the experts, not me, that there's three groups of people that are involved in this. There are the people who design the algorithms, and the question is, are they gender neutral, or do they have a preference to design algorithms which are directed at women or men or something like that? The one question. The second, of course, are the people who provide the data for free, which are the women. And they're a crucial part, because if they don't provide their data. Now, is there a gender difference there? You will know I don't. I can imagine that if you're in Alabama, you will not want to put your menstrual history into an app for obvious reasons. So, one can see that there could be, but you can tell me if there isn't. And then the other group, of course, are that you're collecting the data. I mean, these are basically mechanisms to monetize the data. So you've got to sell it to somebody. And I'm just wondering, is the problem that you're raising that the value of female data, I don't know, is less than the value of generic data, both genders data or of male data? Is that the problem? Because the investors are making a decision on something, and I'm not sure if it's because women are more reluctant to put in the data. I doubt it, but there could be situations in which it would be. There may be an issue with people who do algorithms, and maybe because I guess many of the coders are men, but again, you can tell me. Or is it an issue of of the value of the data and the ability to monetize the stream of data? So I'd just like to know.
Maybe just a few points on my side. I think indeed you're right to say that a lot of the coders are male dominated, right? So, and that's why we have programs like the STEM, to get women, to get girls to get into STEM education, and hopefully through the various generations we get there. But I want to go back to your point on privacy, because I think that is kind of touching on a very key ethical principle when it comes to using AI in health, not just for FemTech, but across AI applications. And that's really looking at protecting human autonomy. Because it's not just about people knowing your data, but it's actually people using your data to characterize you, to understand your behavior, and to sell you things and to influence your health decision making. And I think it's really critical for us to have features in place where we really allow for the women or the men to actually still retain that ability to make the decision themselves based on the information that's provided. So I think, for example, if we have privacy controls options, like, being able to delete your personal data as and when you want, withdrawing from the application as and when, again, if you want, and knowing that there are steps to protect your data, to make it unlinkable, I think that's all going to be very essential when we think about the ethical implications related to AI use in FemTech.
Thank you. I see a couple more hands, please.
Thank you, Sabine, and thank you, everybody. My name is Hilary McNamara, and I'm with the European Institute of Women's Health. And I'd just like to firstly bring your attention to a project that we have done. It's called ideal.eu, and it's into research. It was a 2-year project with Europe on looking at digital health literacy and active living, and a lot of good information came out of that. So I'd like everybody to go further into that if they have any interest. But also I'd just like to comment and say, that AI is a hybrid, as Tatiana said, and her information was fascinating. Everything that you said today is fascinating, but it is also a power struggle, and it's in its infancy. And I was at a tech conference recently, and the AI room was packed out, and the climate room was empty, and the diversity room was empty. So that's where the money is going, that's where the focus is going, and that's where the leadership from a women's gender equality and health is slightly lacking at the moment. So my question would be, Sabine, noting that you've, women in global health and the good work that's being done here and the focus that's being put on it, how do we get that voice for AI for good at the table, AI can be amazing if it's harnessed in the right way, and it can be the answers to so many of our problems, but it can be the cause of future problems and pushing us further down the priority list unless we have as Palin said, everything that we need at the table.
You're right. There's a lot of money right now flowing into AI, so that's why we have to make sure, and there were some other hands up I saw, that we get also in those sessions the gender perspective into, right? Because as you said, if there's a session only on diversity, people go there where maybe the funds are, the future funds, maybe also the women with the good ideas. No? So that we get, like, if we have a panel on AI, that we get women, for example, like Peggy or Pei Ling or Tatiana, like on the panel, that to be discussed and really to bring those issues forward. And that we have really sex and gender aggregated data, that all the applications and AI is suitable and adequate for women's needs. Or like not only women, but for all groups of society, for the diversity of society. So I think this is important. And that's what we always, when we talk about gender medicine and gender, it's actually gender mainstreaming. It should be like, it should be in all policies, it should be actually everywhere. It's mainstreaming. I think, Peggy, yes, that's what you are doing the last 10, 15 years, that we have to think it for all the subjects actually through. You want to add?
Actually, your comment made me think of how we have been approaching our health systems for the many past generations, right? We think of health as a single sort of disease, right? We looked at disease not as a system, but then we look at just like, okay, are you getting malaria? Are you getting AIDS? And we tackle them individually when actually it will benefit a lot from bringing them together, right? Because there's a lot of comorbidities. And I was thinking actually, in future, when you plan panels or when you plan projects, actually climate and diversity should be integrated into the AI projects, because AI itself has such a, like the AI algorithms itself, when you run them, it has such a huge impact on the environment resources. If you talk about climate, you can't, when you talk about AI users and sustainability, you can't get away from climate change and climate per se. So I would say to really approach this whole issue through like a more systems way of thinking, and also to see AI as has this great potential to allow for us to do that. Given the fact that it can process so much data and so quickly, we should really be thinking more at the systems level at this point. Then,
great. Now I will start with you. I think he was.
Nick Goldeman, Professor of Healthcare and Public Health. Following up a little bit on the previous question. So the implications for performing trials with all these requirements regarding minorities, representation of all kind of groups, and creating evidence for AI-based kind of solutions, the implications are huge. So typically, if you perform trials on pharmaceuticals where the sort of underlying mechanism is relatively straightforward from a physiological point of view, but with digital health, about human behavior and effects are far more ambiguous and need more data, more people involved, better representation. So the implication is we need huge investments to do this. Coming back to the previous question, so can we afford really to do all these type of investments, and shouldn't we make choices and put priorities? And if so, are there any other topics in women's health which might be more relevant for women rather than chasing digital solutions, which might be only relevant for a relatively small group? Thank you very much.
Thank you.
Yeah, I'm just trying. I'm thinking here, and I also wanted to get back to Martin as well and his questions as well. I think we can't afford not to, number one, but I do understand the priority issue. Going back to clinical trials again, and you talked about the value, Martin, as well. I think
clinical trials, the value for whoever's buying the data.
Exactly. And I think the situation historically has been that men have been involved, so therefore women weren't for obvious reasons. We were too expensive, actually, anyway, to produce data, or for the researchers to actually produce data on us, because they considered us too expensive. And that goes back to the thalidomide issue, and that was an issue as well of safety as well. So I see your point about priority. We can't afford not to, because women are so far behind now, and if you're looking at issues like cardiovascular disease, neurological diseases, MS, with a huge number, more women have neurological diseases than men, there hasn't been sufficient research, and therefore women are misdiagnosed, underdiagnosed. And is that right? I mean, should we not prioritise women? And really, when we're talking about research and also clinical trials, I think people should be involved who are the end takers of the treatment being researched. So therefore, they need to be involved. So if there is a drug that both men and women are going to use, or diverse population groups, or subpopulation groups, of course they should be involved. And I think that's a very good topic, I think, and discussion for public health experts and for, say, the EMA and pharma. And really, I think initially what we're talking about, I mean, the EU has done fantastic work on legislation for impacting women's health. And I think the first thing we're talking about is implementation at national level. For example, the clinical trials regulation that should involve women and older people, which includes older women. And we need to be more, I think, encouraging in the implementation of these regulations and directives at national level. So we need to be monitoring and evaluating them more. And, you know, the pharma companies need to be also around the table so that we can actually tell them exactly what we're feeling, what the amount of women that are suffering from different chronic diseases, and also national research is universities as well, in the higher educational stakes as well. So you're talking about an education process, again, I think, of the extent of the bias and discrimination against women in research. And again, it goes back to what you're saying as well, from Germany, you know, the whole issue of women being ignored, and women, men that are in the AI room, as Hilary said, they're there because there's a lot of money. Well, I think there's just a lack of investment in women generally. And Tatiana, well, I'm sure would agree with that as well. Sorry for going on so long.
Yeah. No, it's very important. I want to add, and then I give, the other ones their speech time. you know, there are sex and gender differences in all diseases. And as I said at the beginning, women live longer, but they live 9 years in not good health, and men live 6 years and 9 years in not good health. So why is that? And if we look at cancer therapy, I mean, chemotherapy is still, women have more side effects. So that means often the therapy has to be stopped because the side effects are strong. That means the outcome is worse. Why? Because most of the medication is not tested on the women. It's just one example. And what I just said with cardiovascular diseases and heart attacks, I mean, and also the broken heart syndrome, it's mostly in women, and we have different symptoms between men and women in heart attacks. So what are the symptoms that women, for example, suffer if they have a heart attack? Does anyone in the room knows? So, you know, for women, for example, is if they have nausea, it can be here, you know, pain in the jaw or back pain. This can all mean that they have a heart attack. And it's still often, if they are brought to the hospital, it's not diagnosed. It's diagnosed too late, and a lot of even, especially younger women, die. It's still happening now. Even if maybe since 15 years, it was already Professor Hochleitner, it was Professor Regitz in Germany. They have, you know, told the health professionals and the nurses, please pay attention. If a woman with those symptoms come, it could be heart attack. But we still see it worldwide. So this is one of the points, and this is why I agree with Peggy. It's hard to prioritize. It's just, I mean, we are half of the population, and it's female technology is also not a niche because half of the population, and it's a huge market that can be explored. But that's all from what we want to add on that. And now we have, I know you had raised your hand, and you had raised your hand, and there was the third person. Please, if you could help me. Yeah.
Maybe just for clarity.
Yes.
My question was not whether women should be involved in clinical trials or not.
Mm-hmm.
The question is, should we invest a huge money in AI? Is that the best way to help people? Yeah, is that, yeah? So I don't want to create any confusion about that.
Yeah, okay. Okay. But I would like now to give the next speaker from the audience first the word.
Hello, I'm Shuti Chu from Taiwan, former Director General of Health Promotion Administration under Ministry of Health and Welfare, and currently the President of Health and Sustainable Development Foundation. My question is, speaking of gender health equity, how does technology contribute to help improve gender health equity? So following the gentleman's question, one side, what's the priority? Do we have the contributions from women regarding their needs and demands of the inequality issue? Which problems should be prioritized? And on the other side, about FemTech, I would like to know from Tatiana, the current distribution of the perhaps solutions or investments on women's health issues. Does it reflect the expectation? And how do we, so then how do we direct such initiative to speed up, to meet women's need, and to help reduce the health inequality to speed up the improvement? Yeah, thank you.
Thank you. Maybe equality was first Peggy and then Tatiana. Would you first say something to equality, or and then first Tatiana and then you add? Tatiana?
Yeah.
Please.
Hi.
Did you hear the question well? Yeah, please.
I did. It was a very complex question, and it'll take a lot to unpack it. But just maybe to break it down into smaller parts, in terms of investment we're seeing in women's health, probably the largest volume of investment still goes into reproductive health, and still women are being seen kind of. Women's health is still focused on reproductive health mainly. We've seen a slight change in that, but I would say reproductive health, cancer diagnostics is probably the one of the largest investment that we're seeing, and of course AI goes without without saying, but it's rather not a solution itself, but it should help a solution, as Martin was saying before. In terms of the other question was in terms of how technology helps breach the health inequity gap, right? And of course, it can absolutely help with health equity. Of course, again, AI and machine learning, these technologies can analyze large data sets and for specific gender health patterns. For instance, you know, historically many clinical studies were biased towards men, and AI hopefully can correct these biases by analyzing diverse data to develop more inclusive healthcare solutions. And that's why we keep talking about AI, because it can really accelerate the innovations within women's health. Precision medicine is also, you know, advances in genomics and personalized medicine allow treatments to be tailored to individuals based on their gender, on their hormonal cycles, on their genetics. And this is what, again, at FemTech Lab, this is what we've been seeing quite a lot, the rise of personalized care, because even within women's health industry, each woman is different and deserves to be treated according to her specific setup of, you know, hormonal health, etc. In addition, telemedicine, you know, we're saying that not all people have access to technology, and it's absolutely true. But at the same time, even less people have access to doctors. So we have some startups in developing countries, in Pakistan and India, helping developing those telemedicine solutions for rural areas where even, you know, one computer for a village can solve a lot of problems to accessing healthcare. I'll pause here because I think Peggy can add much more.
No, I think you've answered very comprehensively, Tatiana.
Thanks, Tatiana. So there was, yes, but you had your question first. And then
Thanks very much. I would actually like to circle back to something we've heard from the online audience before, because I think it's very important. That is the question of how to implement new technologies like apps and AI into a already existing healthcare system, because this has a very important second aspect in a mostly publicly financed healthcare system. The question of ownership arises, and the question of who owns the apps and who owns the data, who owns the intellectual property. Things like that are also, I think, important questions to ask. So maybe you could also speak, if you know any real-world applications that have already been done, would be very interesting.
Thank you very much. Very important question. Actually, Tatiana, I would give this also to you.
Yeah, absolutely. Need to think about real-world examples, although I'm sure that there are plenty. But in the UK, for example, we work closely with NHS and GPs to provide access to the digital solutions to the physicians on the road, being able to access data. Although integration into NHS takes a lot of work, similar with DIGA, I guess, but it's a step towards the right direction.
Maybe I can add something as well. So I think to really have these AI applications fully integrated, I think we need a lot of governance and regulatory frameworks in place, right? And that's why I think with the EU AI Act and even with existing medical devices regulations, that will eventually help us get there. And Tatiana talked about how, with NHS, there are already existing examples there. But I think what would also be important, besides the pre-market, let's say, approvals, what is also really important is the post-market surveillance. So once the applications have been used or deployed in the real-world setting, how can we ensure that they are actually still performing to the standard that they are supposed to, given that the new data they are being trained with in the real world. So I think having that kind of pre-market pathways and having very robust post-market surveillance systems that can really provide early warning sort of signals to regulators, to providers or manufacturers, I think that would be very key. These are infrastructure that needs to be in place before we can fully integrate these applications.
Thank you. Actually, we only have 2 minutes left. I would therefore turn once again quickly to the online audience, and then we would finalize the panel.
Well, there were actually not that many contributions from online. We have heard the contributions from here. There were just like comments on the interesting discussion that we have heard and the important topics and aspects of digital health. And yes, so I would say thank you from my side and from the online side. Super interesting, thanks.
Then I would close this panel, and maybe we can discuss your question also in the break. First of all, we still see a gender health gap. I think we have outlined this very clearly, and FemTech has potentials to actually close this gender health gap. It has potential, but of course the risks and everything that has to be tackled concerning privacy is still an issue that we definitely also on the EU policy level, and I'm looking at Peggy, definitely we have to kind of move forward also within maybe the EU manifesto. And we also, and get into more discussion with the European Medicines Agency to kind of go forward also in this direction. But also if we talk about everything that is related to FemTech, we should not forget the digital divide between Global South and Global North that we have also discussed. So definitely how to support, first of all, women in the Global South, but also make sure they have access to the internet and to be able to use those tools. And coming back, last words again to the trial. So everyone here in the room, if you start a trial, if you're from a pharmaceutical company or if you're working at a university, please make sure you get enough women and the diversity into your study design. And now to conclude, there's the UN Summit of the Future right now discussing the SDGs. And of course, what we are discussing here is SDG 3, good health and well-being, but of course, gender equality. And both SDGs go hand in hand. I mean, if we want to have like good health and well-being realized, we have to take gender and sex aspects and gender equality in healthcare into account, and the other way around. I would like to close this panel and would like to thank again the European Institute of Women's Health for organizing it, and of course Women in Global Health Austria for co-organizing. Again, happy birthday, and try to celebrate a little bit your first birthday during this conference. Thank you very much.